Hi, good morning. This is Mahekdeep Kaur. My student ID is 1198252222. I'm here for wound dressing procedure. Let's start with having a 360 rotation of the camera. Before going to the patient, I'm going to perform hand hygiene. Now let's go to the patient. Hi, good morning. This is Mahekdeep Kaur. I'm your nurse today. I'm here for wound dressing procedure as I have my physician's order. Is that fine with you?
Yes.
So may I know your full name and your date of birth?
Jobanpreet and 27/8/2000.
Can I see the wristband? Yeah, it perfectly matches with my record. May I know if you have any kind of pain?
No.
No. On a pain rating scale where 0 is no pain and 10 is the maximum, how would you rate it?
0.
Okay. My patient has no pain. On pain rating scale, the level of pain is 0. There is no need of medication. Do you have any kind of allergies?
No.
So my patient does not have any kind of allergies to drug, food, etc. Now we are going to elevate. I'm going to elevate the bed to my height. So I'm going to reposition the client. Could you please move? Yeah. Now I have repositioned my client. So I'm going to provide privacy to my client and I'm going to do hand hygiene. After this, I'm going to open the tray firstly away from me. So I'm going to reposition the tray from diamond shape to square shape. Repositioning the tray. Maintaining the 1-inch border, placing the tongs here. So this is a sterile feed, this is my sterile tray, this is the garbage bin, and this is my patient. So I'll be maintaining the sterile triangle throughout the procedure. Now I'm going to add supplies to my tray by banana peel method. Firstly, I'm going to add Q-tip. Discarding it off. Now I'm going to add surgical sponges, cotton pieces, and discarding it off. Now I'm going to pour normal saline to soak the sponge pieces. So I'm going now. What I'm going to do is I'm going to perform hand hygiene again and wear gloves. So now we are going to assess the old dressing for any kind of like drainage. So on the old dressing, we can see that there is like a small amount of serosanguinous fluid, but there is no active bleeding, no pus is present. We are going to discard this old dressing. So talking about the location of the wound, it is present on the left side on the lower upper arm, and measuring its length, we'll use the Q-tip. Maintaining the sterile border. And measuring it against this measuring scale and discarding the Q-tip. The length of the wound appears to be approximately 5 centimeter, and now I am going to palpate the wound. Do you feel any kind of pain?
No.
Okay. So overall about the wound, the location of the wound is on the lower upper arm, lower forearm, and on the lower forearm on the left side, and it is 5 centimeter in length. It is close to each other and closed by sutures and well approximated, and there is no presence of edema. There is mild erythema that is present, and there is no pain present at the wound side. So after this, I'm going to discard these gloves. Going to perform hand hygiene and wearing the new gloves. So now we are going to clean the wound. So we're picking this forceps with it and So these gauge pieces are already soaked in normal saline. So we'll be cleaning the wound with the normal saline, with the gauges soaked in normal saline by making the dumplings, removing the excess of normal saline. So firstly, I'll go from head to toe, from least contaminated area to the most contaminated area and the area that is far away from me in a single stroke, and discarding it off. Now I'm going to make another dumpling, squeezing it off, and again head to toe to the area that is closest to me, so in a single stroke, and discarding it off. So this is the third. This third dumpling is for the area from head to toe along the midline in a single stroke and discarding it off. Now we are going to pat dry the wound. Again, we are going to make the dumplings and follow the same sequence. So firstly, from head to toe to on the area that is far away from me, and patting it dry from head to toe, discarding it off, and again this dumpling to the area that is closest to me, patting it dry from head to toe, discarding it off. So another dumpling to pat dry the area from head to toe along the midline and discarding it off. So I have cleaned and dried the wound area. Now I am going to add gauze pieces over the area to cover the wound. I am adding another gauze piece. Since the wound is secured by another gauze piece, there is no need of additional pad. But if the wound has some kind of bleeding, and for that drainage, we can add that pad. So now we are going to secure this dressing by taping it on all the four sides along the border. We are going to have additional tape applied to it, and on this tape I will be writing down my initials and date and time of the procedure when this wound dressing has been performed. Now I'm going to ask my patient, like, do you have any kind of pain?
No.
So are you comfortable?
Yes.
So the procedure and my patient is well tolerated. Now I'm going to ask the patient, now I'm going to lower the bed. So I'm lowering the bed and repositioning the client. Could you please move? I'm giving a bell to the client. This is a call bell. You can press the bell whenever you need me. So this is all about it, and I'm going to now remove the gloves. So this procedure has been performed, and I am going to document the whole procedure when the procedure was performed along with all its findings. Now we are going to do 360 rotation of the room. Thank you.